Hi, everybody. I actually was not expecting this big of a crowd, so I am really excited to have so many people in the room. And I do love an interactive presentation. So if anybody has any questions along the way, you can either put it in the chat, raise your hand, and I'll do my best to answer the questions or to pivot on the topic that we're talking about. Um, so I'll go ahead and get started. We're going to be talking about the common sex and intimacy issues and then how they're addressed in sex therapy. So I am a licensed psychologist. Actually went to my doctorate program with Dr. Root. I'm also an asexed sex therapist, a certified sex addiction therapist, and I've been doing EMDR for longer than a lot of people know that it even existed. So my foundations are in trauma work, which is what actually brought me to working with in sex therapy, because as you know, for a lot of people, their trauma is sexual. And so I didn't want to just get people trauma less. I wanted to get them to a place where they were able to thrive and have really fulfilling, healthy sexual lives. So oh, I am not going forward. There we go. So here's our learning objectives. We're going to talk about the common categories. Then we're going to move to the differences between like the medical and the psychosocial contributors to sexual difficulties. We're going to talk about how we can apply, this is the fun part, how we can apply some of the sex therapy strategies to like sensate focus, the dual control model, the wheel of consent. And then we're also going to talk about how as primary care physicians and as mental health practitioners, we can normalize and reframe some of the sexual struggles. As we go through, we'll address some of the myths, some of the things that are out there about sexuality that may or may not be true. Okay, why this matters. Um, this might come as a shock to you guys. People actually like to talk about sex. And so they want to talk about it. And oftentimes I hear people say that they went to their primary care physician and they had like a whole plan of what they were going to say, and they just couldn't actually get the words out. And oftentimes people think that what they are experiencing is really unique to them. And so they don't even actually know the questions to ask. And so if you guys are courageous enough to ask those questions, how is intercourse feeling? How satisfied are you with your sexual life? Asking those questions, oftentimes people are more than willing to dive into it. And I may be a bit biased, but I believe that sexual health is very, very important and it contributes to overall health. So this is where I wanted to check in with you guys and see what you see your patients bringing to you as far as their sexual concerns. So I went on and did a little bit of research and I was like, what's the 10 most common sexual issues that people bring to their doctors? And what I found was somewhat gender specific. So with men, oftentimes it's erectile dysfunction, surprise, surprise, low libido, and questions around testosterone. It's been, testosterone is really having its moment right now. And so a lot of people are like, what, you're on it? You're on it? Okay, I want to get on it too. I want to feel better. For women, oftentimes it's low desire, orgasm difficulty, and then also really painful sex. Oftentimes people, they just come in because they want to talk about contraception or there's STI. And so they are sort of forced to talk about it because there is a problem that they have to discuss. And unfortunately, less often talked about is people's orientation, people having a history of abuse and a history of trauma. So as I looked at the long list of what a lot of people bring as common issues to their doctors, I was able to divide it into four different categories. So the four categories that we're going to cover are performance and function, which would be the erectile dysfunction, it would be the vaginismus, anorgasmia, pain during sex, and anything that has to do with the way that we perform, which I hate that word, by the way, or function. The second one would be around desire and arousal. I think that's self-explanatory. As a couples therapist, oftentimes when people come to me, they want to talk about that desire incongruency that they have in their relationship and how to be able to sort of bridge that gap because not everybody is the same. And so when you get two people together and you're like, okay, right off into the sunset and live the rest of your lives together, no matter what's happening psychologically or with your body, and you're always supposed to be on the same page, it really doesn't work. Um, the third one is going to be about relationship dynamics, because as we all know, oftentimes when people come to me hoping to improve their sex life, I'm teaching them about I feel statements, teaching them about how to be able to all of the Gottman skills on how to just be able to get to know their partner so their partner feels safe, so their partner is able to have intimacy. Um, and then the fourth one is under the emotional and the cultural blocks. And as we go through, I'm going to try to have like a specific format. So we'll talk about like what they say, what the patient concerns are, what some of the common misconceptions are, what the medical interventions are, and then what the sex therapy interventions are. But first, first I came up with like this, how do I go back? Yeah, I came up with like this format and it was very sterile and it had like lots of bullet points and lots of this is how we're gonna move through this. And then I thought like, no, I want to start with the good stuff in the beginning. And so what I'm gonna start with now is my favorite sex therapy tips and tricks. I'm calling it tips and tricks because that sounds more tantalizing, but what you guys know that it actually is psychoeducation. Because people, they're not reading all of the books that I'm reading. And so my bookcases over here, I've read all the books. And then I want to be able to give you guys some of my like favorite things that I use with people that might just be helpful little tidbits that will normalize, that will stimulate, that will allow them to feel more comfortable, to be a little bit more open and to have the conversations. And you'll notice as we go through that all the book titles and the images are uh, uh, they're fun. So here is one of my favorite books by Emily Nagoski, Dr. Emily Nagoski. It's called Come As You Are. So this is about the neuroscience of female sexuality. And I love this book. I recommend it to almost every single one of my female clients. And their male partners, if they are willing to read it. It's very, very informative. And essentially, what she talks about is that in order to get the juices flowing, so to speak, women need to be able to feel safe. They need to know that they have boundaries that they can stick up for. They need to be able to be in a place where they're able to lean in and to let go. And again, this might come as a surprise, but in today's society, a lot of women have a lot of stress and a lot of things that they have on their plate. And so the more things that are on your plate, the less ability you are to get inside of your body and to let go all of the stresses that you have. So the number one thing that she talks about is context. And oftentimes guys are like, and sorry, a lot of this will be heteronormative, but we are going to be talking about some more marginalized populations on the back end. Um, so a lot of times men will say like it's like she's trying to play a tit for tat, and if I clean up the kitchen then she'll give it to me. And it's like, well, but what's actually going on is when you clean up the kitchen, she feels seen, she feels cared for, she feels nurtured, and it's one thing off her plate, which provides for more room to be able to get into her body and to be able to realize like, oh, there actually is some desire there and I actually like you and I might want to spend this time with you. But I think one of my favorite things that Emily Nagoski talks about is the dual control model. So if you're interested in this book, and I'm happy to send you the quiz as well, it's a quiz that is the SES and the SIS. So it's the sexual excitatory system, which is the gas, and then the sexual inhibitory system, which is the brakes. So much about when people talk about sex, they're like, hey, what turns you on? What really gets you going? But it's not all about what turns you on. We also have to pay attention to when the brakes come up. And so research shows that for males, oftentimes it's primarily about the gas. They just feel excited, they get turned on, turn on the gas, and they're able to go. And that women have quite a few more breaks. Trauma and having our sexuality being objectified from the time that we went through puberty. There are all sorts of things in society that a guy, husband, partner, female partner, someone might say into their ear, oh, he looks so hot, which would seem like that would be something that would turn them on. But if at some point when they were 14, they were walking down the street and there was a construction worker that said, hey, you look so hot, it then feels objectified, and the brakes go on and they're not able to either lubricate, get excited, they're completely out of the moment, and then sex isn't enjoyable. And so this quiz that you're able to give people, it asks a ton of questions. So you know what your brakes are, you know what your gas is, and you know what your brakes are. And it really helps to understand yourself and your own body, and then also understanding your partners. I would be remiss if I didn't give a nod to my favorite sex therapist, Esther Perel. She brings in this idea of erotic intelligence. And so erotic intelligence is this idea that if you're an attachment nerd like me, you know that in order to have secure attachment, you have to have safety, you have to have security, you have to have consistency, reliability. But in order to have erotic passion, oftentimes you need novelty, you need adventure. And so, how can you do both of those in the same relationship? And so, one of my favorite books is called Mating in Captivity, Unlocking Erotic Intelligence. And it just sort of talks about how, if you are in a committed relationship, how you can bridge the gap between there, because you really need both in order to have really passionate, intimate, healthy sexuality with your partner. And I have on this slide here, I showed she's got a couple of different ways that you can learn about her stuff, this book, and then also she has a podcast that's out, and it's called oh, this is not the right podcast, so take note of this if you want. The podcast is called Where Should We Begin? And I actually have that there on the slide. And then this deck of cards, which is so great for couples. The Gottmans have some that are called salsa cards. There's one out there called sexervations, like conversation sexervations. And really what this is just to prime the pump, just to be able to have those conversations, because so often people, they've been in a marriage for 20 years and they don't know what their partner's fantasy is. They don't know when their partner first had an orgasm. They don't know what really actually turns them on. And so it's just a ton of questions that go, from one end to the next. This is about that erotic intelligence. But I love this little image because it talks about how on one side you really need that secure attachment, safety, reliability, consistency, and then you also need the passion on the other side. I'm going to speed up a little bit. I was telling Shannon beforehand that once I switched topics from sex addiction to sex therapy, I was like, okay, now I want an hour because I have so much to talk about. So maybe I'll come back. So this is a book that I think every man should own. It's called She Comes First. And what I love about this is Ian Kerner, who wrote the book, he is a self-admitted pre-ejaculator. And so he says early on when he started having sexual experiences, he would ejaculate too quickly. And it was hugely shaming for him. And so then it became trauma, and then it became anxiety, and then it became panic. And then he became isolative and didn't want to go on dates. And so ended up, people like that. There's a case study I'm going to talk about too. People like that will often end up into addiction because, as we know, one of the greatest contributors to mental health is isolation and loneliness. And it's like, who would have thought if you take that all the way back, it goes to a moment of pre-ejaculation. So basically what he says is, if you do not even think about your quote unquote performance and you are just able to please the woman. Like there's images about cunnilingus, there's images and tons and tons of diagrams and neuroscience, and educates people on how to be able to please the woman, because then if you get that out of the way, then you're able to let go of the anxiety about your performance, and you're actually able to lean in, and how this was sort of the recipe for him to be able to have healthier sexuality. Sensate Focus is tried and true. It's one of the older methods that's out there. It was originally developed by Masters and Johnson. And really, with the new wave of mindfulness, who knew that there's actually something to mindfulness when it comes to sexuality? And so really this is about people, like, how does it feel when I have my partner touch my forearm like this, and really focusing in on not only how does it feel on their fingertips, but how does it feel on my arm here? And then you move to more erogenous zones. Um, this brings back curiosity, it brings back presence, it brings back play. So oftentimes my prescription for a lot of my clients will be, in between now and the next time you come in, you are not allowed to have penetrative intercourse. You are only allowed to make out. And so oftentimes, if there is one partner who has lower desire than the other, if that is taken off the table, the pressure of I'm either going to have painful intercourse or I'm not going to be able to perform, all this is just kissing, you would be surprised at how excited people can be and how pleasurable that will be. Um, and then taking turns giving and receiving. And so oftentimes I will say, for this next week, you are only allowed to receive. You are not allowed to do anything to your partner. All you're allowed to do is sit there and enjoy. And so this is often really, really hard for people not to touch or move or feel like they need to do something in order to be worthy. But in order just to be able to give or just be able to receive allows them to really step into their body. The Wheel of Consent, there are workshops all over the country about the Wheel of Consent. And essentially, it's what I was just talking about. And this wheel is actually very popular in BDSM communities, because the number one thing you need in those communities is boundaries, clear, set transparency about what is okay and what's not okay. And so I'm not going to go into explaining this one right now because we have quite a few more slides to go. But I would say look into this. There's a workshop here in Austin, Texas, that I send people to often. It's Friday, Saturday, Sunday, and you just practice the Wheel of Consent. You can go with a partner, you can go and just practice it with other people. And it's essentially that sort of thing. Like, when I did the workshop, I would say things like, well, it might be nice if you could move a little to the left. And she's like, no, Stevie, say, I want you to move to the left. And so it helps you practice how to pay attention to your body and then ask for what you need and don't tiptoe around it. So there's workshops, YouTube videos that will explain it better than how I'm able to right now. I think one of the most important things for people to look at is how they feel about sexuality, what the beliefs are that they have around it. There is an exercise that I give people. It's actually from this book, Woman on Fire, and it looks at old beliefs versus new beliefs. And so an old belief would be something that was handed down to you by your mother or your grandmother, that good girls don't enjoy sex or good girls don't ask for what they want. And so you're able to examine, this is what was told to me and this is what I have believed, but here I am in my 40s, I run a company, I'm a powerful woman. Does that still fit with who I am today? That good girls, do I care about being a good girl? And what does it mean if I ask for what I want? So being able to decrease any sexual shame, examining the beliefs that you have around it. And then Gillian Anderson, actually this book Want is, I recommend it a lot for women to listen to. Um, and men too, if they want ideas. But it is a collection of anonymous people who came on and told what their fantasies are. And it's on Audible, and you can just listen. And there will be things that shock you. There will be things that you're like, I never really thought about that. And there will be things that you have thought about. And then you hear that other people also thought about it. And you're like, okay, I'm not a weirdo. So it really helps with that normalization and helps give you some fun ideas. And I keep talking about like, give this to your clients, but I know, please use these books. Give these books to your friends, give them to people that you know, because it is so important for people to really be able to open their minds. Along with decreasing sexual shame, these are my favorite books for people who are not heteronormative. So the first one is Rewriting the Rules. And this one really takes a look at what sex looks like in our society, and then what it looks like in some of the outer fringes, as far as ethical non-monogamy, BDSM, some of the like polyamory communities. It just takes a look at those things. The new monogamy, there is also a worksheet that you can do with this, and it sort of like looks at the continuum. I do this with couples often, that where is their line for betrayal or infidelity? Is it when you fantasize about someone else? Is it when you watch porn? Is it if you actually touch someone else? Is it an emotional affair? All the way to like gangbang, like as far as you can possibly go. And so you're able to sort of like, we're going to go through these one at a time, and each person let me know where you're at on this. Sex at Dawn is a phenomenal book on Audible as well, that just sort of talks about how religion played into sexuality, and talks about like the evolution of sexuality. And then this book is gay. One of my favorite books, and it talks about LGBTQIA plus, everyone on the continuum. It talks about some of the difficulties of being able to be in our society and be marginalized. Okay. Unfortunately, this is like halfway through. So, um, but I'm noticing the time. So I wonder if I should maybe open up for questions at this point, and then you guys will have the PowerPoints. And as you can see, each of them sort of go through what the patient will bring, the common misconceptions in the doctor's office, desire and arousal. One thing I feel like it's a public service announcement that I need to say is that oftentimes people will come to me, and oftentimes women, they think that something is really wrong with them because they're not able to orgasm. And I think it's important for all women to know that only 18% of women are actually able to orgasm from penetration. If you're all doctors, so you know how anatomy works. If you think about how anatomy works, the penis does not hit the clitoris, which is the place where orgasms come from most easily. And so if you are in that 18% and you're able to, like, good on you, but it's not very common. And I think that oftentimes shocks women, or shocks many people when they find out that only 18% can. And
Hey,
then converse,
Stevie.
yes.
We can actually just let you keep going if you'd like, and Savannah has offered to move her case to another day. So if you want to just dive right into this and keep going, you're welcome to.
Um, I might not have the full time because I've been
Okay,
rushing through. Um, but maybe like extra 10. Will that work? Or
sure, great.
okay, okay. Thank you, Savannah. So where was I? I also think it's really important. A lot of times women say, I just like my husband will be at work and he will text me that he wants a nude or text me that he's horny and he has this spontaneous desire. And there is a difference between spontaneous desire and responsive desire. And it is also very rare for women to have spontaneous desire. We oftentimes are not just like sitting in our office and think, wow, I really want to have sex right now. That doesn't happen very often. Again, if you are in that minority, great for you. But for women, and I think that this is important for men to know as well, is that oftentimes you have to, that it is responsive. So you have to sort of like prime the pump, you have to sort of get started. Let me see. Actually, there is one thing I want to go back to. So when it comes to performance and function, oftentimes patients will say, I just don't like sex. It's not enjoyable. Oftentimes that is because it is painful. Oftentimes men are worried that they're not going to last long enough or they are going to take too long. So these are some of the issues that I think a lot of times you guys as doctors probably have them coming to you to get testosterone. So one of the common misconceptions there is that erectile issues is not always about low testosterone. Um, and this looks like it's true, but it's saying a misconception is that porn is real. So it's important for people to know that what they're seeing in porn is not real. Men do not last that long. They are not that big. They do not last that long. Um, and oftentimes women are not able, their bodies are not able to react in the way that we see women reacting in pornography. So in the doctor's office, you want to make sure to rule out any vascular, metabolic, any medication contributors. I don't know about you guys, please help people to understand this, but I cannot tell you how many clients come to me with erectile dysfunction or inability to orgasm. And the biggest contributor that I have noticed just anecdotally is Lexapro. And so they are like in crisis, their relationship is in crisis. And then they tell me that they're on Lexapro and their doctor has never let them know that there were possible side effects. And so they get off of it and it takes 3 to 5 months for them to be able to get to a place where they are then able to have normal erections, have normal desire, and actually be able to get to orgasm. I have some of these men come into it's women too. It just seems like that's when it's the bigger issue when they're coming to me. And they've gone years without even being able to have an orgasm while masturbating. And they never knew that it was their antidepressant meds. So screen for menopause, screen for postpartum, pelvic floor dysfunction, and then offering HRT when it is indicated. It's also been a miracle worker for a lot of my people having testosterone on board or different hormones on board. Um, so I guess the thing here that I feel like is important to mention is that there is nothing necessarily wrong about pornography. For some people, it is not within their values. However, for a lot of men, especially like the guy that I was working with, Chance, he had porn in his pocket at 12 years old. And so from the time he was 12, 13, while his sexuality was developing, he was watching pornography. And to not have the anxiety about your performance, to not have the anxiety about if the other person is enjoying it, to not worry what your face looks like or how long you last or if you're lasting too long, to get rid of all of those psychological factors. Oftentimes that's the reason why partners are able to function and perform when they're watching porn rather than with their partner. And the way that this really can disrupt relationships is the oftentimes their partner feels as if they're not enough. and that the people, the women that they're seeing in porn or the partners that they're seeing in porn are better than them. And that's why their partner is not able to get to orgasm when they're with them, but it's actually psychological. And so I have a lot of men do a porn sabbatical, go at least 90 days. And it really helps to reset your neurotransmitters so that you don't associate being able to be like, redheads with small feet and big boobs. Like I want exactly what I want, exactly when I want it, and that you can actually get in your body, be with your partner, and it will really increase sexual satisfaction. And then a lot of these 20 somethings, which is when we talk about sex addiction, those are the contemporary sex addicts. It's more because that's all that they've ever known. And so then it actually becomes like a coping mechanism. It's not just something they're doing for pleasure. It's something that they're doing to regulate their emotions. Um, so yeah. Okay. I'm happy to answer any questions, but I don't want to take up too much time so we can.
Stevie, this is Rachel. I have a question. Thank you so much for all this information. So I have been curious about this too, and admittedly, probably because I totally traumatized my 16-year-old nephew at one point talking about some of this stuff with him. Um, and so, is there any recommended ages where the brain has developed enough and that porn becomes a little bit less, it becomes a little bit less dicey? Because I know that there's been some of those documented cases of, kids who have porn in their pockets and that's what before they've even had sex or touched someone, and that is kind of what their brain thinks porn is or sex is supposed to be like. And then they get into the real world and it doesn't look like that. And so arousal and performance and function becomes very, very, very difficult because it doesn't kind of meet the standards of what they have primed their brain to think, kind of like you were talking about. Is there a recommended age? Are we talking like, is it best to do it when your, brain is fully formed? Anything on that can kind of help guide?
Yeah, yeah. I don't actually know of any research studies about that, but my best guess would be waiting until their brain is formed, which in today's society is going to be absolutely impossible. And so, like, what I would say would be the next best antidote to that is being able to talk to them about how what you're seeing is not actually real and that you don't want to rewire your neural networks to where you're not able to actually have great sex with a real live human with a pumping heart. You want to be able to do that. And so oftentimes what I'll do is I'll say, there is absolutely nothing wrong with masturbation. I actually encourage it. I want you to do it to be able to get to know your body. Just do it without porn. Do it with fantasy, because then the fantasy you can tell your partners about, and then you guys can play and lean into pleasure and have fun with that.
That's perfect. Thank you.
Sure.
We had another question in the chat, and then Stevie, I know you've got two more components here that you want to talk about, so you are more than welcome to do that. But the question first was from Catherine Fleming. Do you have any book recs for teens or kids to talk to them about sex, consent, and pleasure?
I don't work with teens, and so I don't have any recommendations off the top of my head. I apologize. But I would say if you as educators and therapists and as parents reading some of these books, like I think the Emily Nagoski Come As You Are, it gives so much like juicy science behind it. So for you to be able to be educated, to be able to talk with them about it. One of my friends the other day, her 15-year-old son, she knocked on his door and he didn't answer. And she said that like later when he came out, that she was like, I like, you get to have your privacy, but it's just really rude. Like just say to me, hey, I'm busy or I'm not coming. But I knocked like a few times and you didn't say anything. And she said that he said to her, sorry, mom, I was masturbating. And I was like, good job, Sarah. Like, just the fact that he at 15 felt comfortable to tell his mom I was masturbating. And it wasn't like a bad person or that he was going to get in trouble from her. I was like, that shows you're really doing something right. The fact that he was able to tell you what was happening behind that closed door. Yeah.
And then it looks like we had just a couple. Ashley put into the chat, loveisrespect.org and Planned Parenthood have some great online resources. Camille said Amaze with a link to it. Has some excellent videos for kids and teens.
Great. Thank you. So if we want to keep going, do we want to stop so Savannah can go?
We actually we moved Savannah to another date, so you are good to go. This session is yours, Stevie.
Okay, good. Thank you. I've taken it over. I've monopolized it. Okay, so the third issue is relationship dynamics. So oftentimes they come in and say, I really love my partner. I really love them, but it feels like we're roommates. We're just not hot for each other anymore. Oftentimes I work with couples where there's been some sort of infidelity, and it is really hard to get to that place of trust and intimacy when there has been betrayal trauma. And then also, we just don't know how to talk about sex without fighting about sex. So some of the common misconceptions here are if we love each other, then sex should just be easy. Like, that's a bunch of malarkey because and feel free to raise your hands. I hope that there's some in here who out there had really great role models of parents who were affectionate with each other, who talked about sex, who uh, talked about feelings, who were able to see each other as equals. I'm sure a lot of you have read Terry Real's book, Us, but it talks about those different quadrants that you're in and how important it is to have equality and to have boundaries in order to be able to have healthy intimacy. And unfortunately, a lot of us, most of us, didn't really have great role models on how to do that. And so in the doctor's office, some of the things you can ask are, how satisfied are you with your sexual life? I know it's not part of a normal HMP, but I think it's important. And to be able to normalize some of these relational struggles as something that is true. So I use a lot of these teaching moments, the Esther Perel's erotic intelligence, that difficulty between having that safety and security with your person that you depend on for everything. You see them going to the bathroom in the morning, they bought the wrong milk at the grocery store. It's then hard to have novelty with that person. And so being able to use cards like this, doing the Gottman salsa cards, being able to find ways where you can sort of play, but also push those boundaries just a little bit for that feeling of novelty and risk, and doing it together and being able to have communication and transparency about that. There was a couple that I saw that they came to me because they were polycurious. They were in their mid-50s. They're like CrossFitters. They're like this beautiful couple that their kids had gone off to college, and here they were in the house with themselves, and they were like, we just want to spice things up. So we think that we need to open up our relationship. And I've had many couples who have come to me and I have walked them through that process. We have gone through the new monogamy agreement. We've gone through the continuum. We've figured out where everybody's boundaries are. And then they go out and they screw up, and then they come back and we repair. And it's all part of the process. But this couple in particular, they came and they were like, we think that that's what we're going to do. We're going to open up our relationship. We want to be swingers. And as we moved through that process, they realized that it wasn't about other people. It was more about being able to try new things with each other. And so they ended up, doing the cards, dressing up, going to even strip clubs or to play parties, and going to places where they might observe other people, but they stayed with each other. And so oftentimes it's not that they had to do that, but it's just opening up your mind to what other possibilities are. And then the last issue is about emotions and sociocultural issues. So oftentimes people, they are raised in a conservative religious background. So they are raised to believe that they have to be good in a certain sort of way and that sex is dirty. A lot of times people have different beliefs about their body and they feel that their body is disgusting. And so it's really hard to be able to be in intimate situations and feeling comfortable and feeling in order to enjoy pleasure, you have to be in your body. But if you don't like your body, then you're not able to get there. And then I hear a lot of times, I want it, I think about it, and then in the moment, I shut down. Um, so some of the common misconceptions, that it means you're broken, that if I have trauma, that I'm just screwed. I'm never going to be able to, I'm permanently damaged. And then my favorite, if I ignore it, then it's just going to go away, right? Well, it doesn't, and it pops out in other sorts of places. And so I imagine a lot of times people go to the doctor's office and they are reporting that desire incongruency. And oftentimes they don't bring up to their doctor that they also have trauma, the trauma that they wish would go away, the trauma that they thought, it happened, it doesn't affect me today. And they don't realize that it actually comes out during those intimate moments. So being able to affirm to them you're not broken, and to normalize how they're feeling. So that shame is a really strong break. And so I had mentioned it a little bit earlier, doing that exercise from Woman on Fire, being able to talk about old beliefs and then new beliefs. And oftentimes I'll do an exercise where I have them write down the old beliefs that were handed down to them, oftentimes generationally, through religion, through their community, and they do a an exercise where they essentially give that belief back to that person and say, thank you. I can see how you were trying to help me with this. This is something that I no longer need anymore. And who I am today, the person who I am now, this is my new belief, and owning that new belief. A couple that I work with, the Hendrixes, I'll say, they were a same-sex couple. Both of them were in their 30s, and they did come from a conservative religious background. And for them, it was really difficult because they loved each other. They wanted to have a thriving, healthy sex life with each other. But oftentimes when they got into those moments where they really had to get out of their head and get into their body, those beliefs came up that what they were doing was wrong. And so they weren't actually able to enjoy it. And so being able to sort of examine those beliefs and let go of some of that shame. And then I think I maybe put it earlier on when I was, yeah, let me see if I can just go back, when I was trying to go through it quickly. I did want to talk about, I put it under desire and arousal, but it's all kind of the same thing. They all sort of like meld together. But a woman who I was working with, we'll say her name was Heather. She was mid 40s, and she she came to me because she wanted to do EMDR on sexual abuse. And so we did the EMDR on the sexual abuse, and lo and behold, she was able to make love to her wife. Um, and that wasn't her primary goal. That wasn't something that she came to me for. She was coming to me just to do some trauma reprocessing, and then realized, wow, now that I can put that aside, it's been put into the right part of my brain and I've rewired and I can actually feel safe with an embrace. Then she was able to be in her body and to feel aroused. And they had the most loving relationship, but they couldn't even cuddle in bed because that was related to her trauma. And so her partner just wanted to spoon, just wanted to hold her. And so then what happens is her partner's feeling unloved, alone, and then it caused all sorts of issues in the relationship. When the trauma was gone, they were then able to rebuild and be able to have that intimacy and that affection. Okay, I'm gonna zoom. Sorry if that hurts your eyes. Okay, so some of the takeaways. The orgasm is not the goal. And so I say this all the time. Just enjoy the process. Just enjoy the activity. Just play. Lean into the pleasure. Talk to each other about how everything's feeling. That sex does, it shouldn't be serious. It should be something that you are able to try new things, be creative, and be in a safe relationship where you can do those sorts of things. Um, Sensate focus, again, related to how orgasm is not the goal, but just slowing down and enjoying the moment. And then education, making sure to talk to them about that dual control model. It isn't just about being turned on, it's also like what may be contributing to the breaks. And then also context, making sure they know about spontaneous versus responsive desire, and then some of these myths that we've grown up with. Um, just normalizing, screening for any sort of medical contributors, do all of your doctor magic. And I think most importantly, just opening the door and being able to say, hey, how are you feeling sexually? It it really chaps my hide when I live in like outside of Austin, Texas. There's a town called Dripping Springs. We're about 20 minutes outside, and I know a lot of therapists in the community, and oftentimes people go to them for addiction or for anxiety or ADHD or whatever it might be. And then as soon as they start talking about sex, they're like, oh, we need to refer them to Stevie. They need to go see Stevie. And I'm like, get with it, people. Like, do your own work, be able to talk about sex, because then it makes them feel weird. They have to come see like the sex doctor because their therapist doesn't feel comfortable talking to them about sex. And I feel like some of it comes from grad school, like boundaries. You're not supposed to ask too much. You're not supposed to sleep with your clients. Like, and maybe as someone is talking about their sexual encounter that they just had last night, you might notice some arousal in your body, and that feels really uncomfortable. It feels really unethical. But like, welcome to being a human. Like you're hearing about something sexual. That's what happens. And so really pushing yourself to be able to have conversations with people and not just referring them out because they have some sort of sexual issue going on. And then on the therapy couch, the thing that we're going to do is really exploring that sexual shame, exploring trauma, checking what those breaks might be, and then really working within those relational paradoxes. What is going on with you uh, being able to feel seen and heard and be authentic and set boundaries and ask for what you need? Really looking at that emotional intimacy and that safety in the relationship. And writing those sexual scripts, just sort of like challenging those a little bit and giving them permission to be courageous and be vulnerable. And I think that's it. So our patients are not broken. Um, all of this human stuff is very, very complicated. And especially because we don't talk about sex very often, it is like a big, huge mystery for people. And so this is an area that is just really complex. Medical interventions can work miracles, and really, like I said, I started as a trauma therapist. And then as I got people trauma less, I was like, okay, great. Now you're at baseline. Now let's figure out how to like really love who you are sexually and really enjoy sex. So we don't want people to just survive. We want them to thrive, not to be too cheesy, but it's important. And that's it. Just got resources for you guys.
Stevie, thank you so much. You can go ahead and stop your share, and we have got a couple, lots of thank yous and great information in the chat, but we do have a couple minutes to open it up for some questions. This was really, really fantastic. So thank you so
Sure.
much. I know we did a little bit of a pivot for this topic, and so thank you for being so willing to do that and put this on. But questions, let's open it up.
And I apologize for not timing myself. And,
You
like when
are you are
these two
not the
are
first
in.
and you will not be the last. Let's just say that. If there's
Hey
any
Stevie, it's Rachel again. Another question for you. Again, that was so awesome. Thank you so much for doing this. You had in one of your slides something that is very near and dear to my heart as a, reproductive psychologist working with a lot of new parents and things like that. So I was hoping maybe you could take a second on um, what that looks like after people have their babies and when they're sleep deprived and they have all that anxiety going on. And I know for me, a lot of times I will try to level set with folks and say, I don't think everyone is having, we know that not everyone is having as much gloriously crazy sex as we think that everyone is having all of the time. And I'll bust out this graph of realistic sex after kids and age groups and things like that. But I was just curious about your take on that and how you usually approach that, because I know it's a big time for sex to be a big issue.
Yeah, yeah. Really, it's about for from my side of things, it's really about that relationship and being able to be patient and understanding and not feeling pressured, being able to talk about what is happening, both in your body, how your body's feeling, but also what's happening emotionally, because emotions are all over the place. And for both parents we're sleep deprived, so we're going to be like a little bit more irritable with each other. And I don't know about you guys, but when my partner's not being nice to me, I don't want to jump his bones. And so like bringing all of those things in, because it all plays a part into like what Dr. Nagoski talks about, that context. So being able to just I would say just normalize how it's going to take a little while, like 7 years. No.
Thank you.
I wanted to thank you for mentioning about SSRIs and what you're seeing as far as the washout period in practice versus what we see in the textbook or in the databases as far as being out of the system after so many half-lives. Because me and Corey are having a discussion about that. Maybe there's some.
No, I think that's very useful. I think the majority, obviously, the folks who stop our medications, that's the biggest reason they do. You
Yeah.
know, I have a buddy who's a psychiatrist, and he always says we make you less depressed than take away everything you love by
Yeah.
giving you sexual side effects. But so no, it's a big deal with SSRIs. With the testosterone, you mentioned testosterone's kind of having a moment, and we are seeing it more and more and more. Folks are screening for it. Do you see that helping when you see people they get on testosterone supplementation that it helps with these things you're discussing, low libido, drive?
Yes, absolutely, absolutely. And I feel like, and maybe it's just because I'm out in the suburbs here and it's been on the Facebook pages or in the mom groups or whatever, but I feel like specifically for females, when they go in and they get their levels tested and they're like, I'm at 2, not 22, I'm at 2. And then they get started, it is almost immediately, like a week later they're like, oh my gosh, I can feel my clitoris. I'm able to have an orgasm with my husband. And it improves the relationship, because when your partner is not attracted to you, it's going to affect the way that you feel. And it's going to affect how well you're able to connect emotionally, because you feel really lonely when you're wanting to connect with your person sexually and they're just not into it. So specifically with women, and for me, I hear like more muscle tone, they have more energy, and oftentimes they're like, "Is this how men feel all the time? This is not fair." Like, and so it's been huge, and so I often recommend it in my office.
Thank you very much.
Yeah, thank you very much.
You're welcome.
Stevie, thank you so much. I have one last question and then we'll close out here from Emily. I've started to see a trend in my young adult clients about attraction and variations in sex drive, where initially they're interested in sex with their partner, but then if their libido is low or lower, they take this as a indicator that they aren't attracted to their partner, that they need to break up, that they aren't in love, etc. Any resources or helpful tips?
Again, I would say the Emily Nagoski, and even though it's about female sexuality, it really talks so much about that context piece. Because what can happen too is if one partner, it's like the cat and mouse. If one partner is like, "Are you ready to do it? Do you want to do it? Are you sure you don't want to do it?" Then they have no choice but to run the other way. And so if this partner pulls back, then it gives this person an opportunity to move towards them. And so just being able to take into account all of the different things that are going on with the relationship, because that is what drives the desire.
Stevie, thank you so much. This was a wonderful presentation today.